Hey there, it's Allison, and I received a personal message on YouTube from somebody. I'm not going to say her name because I don't know if she would like me to do that. But I'm going to read you a little bit of the message and then I'm going to respond to that. And hopefully, it will help answer some questions for her and maybe somebody else that stumbles across this. So here it goes. Let's see. I was just wondering if you could make a video on what you do when pre-op patients come home from the hospital. Like, for example, my mom went to a support group meeting with me and she brought up that she needed someone to help take care of me when I come home from the hospital. So a few friends gave me their numbers if we needed help. So that concerned the social worker who is in charge of the support group meeting. She meeting. Okay, hold on. Oh, she was then sharing that with also with my doctor. The social worker called me yesterday, and she and the doctor were concerned about this. They wanted me to be safe, so they both decided they wanted me to have another appointment with the nurse for teaching, and to meet with the doctor one more time before my surgery. The social worker and the doctor wanted me to bring someone with me and my mom that will be helping take care of me. And she's saying she's trying to find a few friends that will hopefully come to help her mom out with food preparation and measuring, things like that. Okay, I will tell you, I'm not an expert. All I can do is tell you about my experience. But I had my surgery 4 hours away, so that was very difficult going back and forth. But as far as being here at home, I needed a lot of extra help because for one, I started out at a really, really high weight. And I'm still really big, but I started out at 544, as you know. And then I had my surgery open, which I wasn't aware of that when I went into it. I thought I was going to have it laparoscopic, but of course, she signed the paperwork saying if they have to open you, they have to. And they did have to open me. So with the big incision and also at my weight, it was difficult to do just normal task at times. And this lasted for a couple weeks, a month. I can't remember exactly, but the first couple weeks were tough for me. So I really did need the extra help, and I think that the social worker and the doctor are right to help you out, you and your mom, just to teach you how to do certain things and more efficiently, and also for you to ask a couple of friends to come to help out with it when they can. I had Joe, my boyfriend, my mom, my aunt, and then some friends would come by and help me out with different things. But so you really will need to see if there are a couple friends, excuse me, who will just come by, not and stay all day or anything like that, but a couple times a week just to check on your mom and see if she needs help with anything. Excuse me. But as far as measuring food and preparation, it'll be pretty simple at first, especially because you're going to be, I know, for a week probably on the clear liquid, so that would be easy. But I would recommend buying a food scale. I bought one at Bed Bath and Beyond, I believe, and it was kind of pricey, but it was well worth it, and I still use it now. And that way you can weigh out your food, and then after a while you probably be able to eyeball it to see how much food you have. But at first it's great to weigh it. That way you don't overeat and make yourself sick or whatever. And plus it keeps me in check. So also I would recommend getting some small plates and bowls. The ones I got from Target, I know you've seen them, the appetizer plates. Excuse me, let me have a drink. Oh, my throat's dry. They are like appetizer plates, and then the little bowls, and you can measure those and see like how much they weigh, and then you can put the food in and weigh it and subtract it and all that. Or you know that those little bowls are a half a cup. So if you're eating something like chili or soup or beans or something, you can kind of just eyeball that. So those are really helpful to have. Also, I would suggest getting like one of the blender cups like I have, or any kind of cup that you can shake your protein in, because I was doing mine in a magic bullet for a while, and it was just getting just to be a hassle. And this, you can just throw it in there, shake it up, and then you just wash it out. It's, it's really easy. But you don't, like, I didn't need a lot of the stuff that I bought. You just need a few little basic things as far as food is concerned. I would just make sure you have at least one protein on hand after your surgery, because you really need to get that in. And of course, you'll be drinking it because you won't be able to eat it first. So I would do that definitely. So and have your sugar-free Jello and sugar-free popsicles, Crystal Light, things like that, and just to make sure you stay hydrated. And also, if you want to get a bottle that has measurements on it so you can track your fluid intake. I mean, also, along that lines, I would suggest just getting a notebook. I've been using this until I got the food journal from my friend, but I've been writing down. This was since, like the end of April. See that I've been writing down what I've eaten, and it really helps out. This is today's, and it just helps me to see what I'm taking in, and if something I need to change or add, or and it helps me to keep track of the protein and the fluid totals and all that. So I would definitely just a cheap little notebook, and just write down, and that way you can keep track of how much fluid. That way, if you're feeling dehydrated, you'll know, like, if you've gotten enough. But just a few basic things like that. And as far as like personal hygiene issues afterwards, I did need help. I know that I'm not ashamed of this. I know I've said it before, but I had to have help getting into the bathtub and bathing. Now, this was just at first because it's hard to bend and move and all this. So when you go for the teaching, they should show you these things, but it would definitely be a big help, I know, to your mom to kind of know what to do, and you'll if you have yours laparoscopic, you'll also not have as many problems, I don't think. But I think it's great that they're doing this class for you, because I think it will really help. And if your friends or a few of them can come by at least like once or twice a week, just to kind of give her a hand, that would be great. But I would just get things on hand like baby wipes and just stuff where you can just freshen up really quick if you need to, because you may or may not be able to get into the shower every single day, maybe every other day or something like that. But these are just a few tips that I used. It may be tough at first, with getting around with a pain, but I found that the more I did move, the better I felt. So just keep that in mind. It just, the pain will subside, and just, follow your doctor's orders with your diet, and I think you'll be fine. And if you have any more questions, you can just let me know. But this is just kind of my experience, and I hope that I answered some things for you. And I wish you the best with your surgery at the end of the month, and I will talk to you soon. Bye-bye.